And to the 3 keys to a strong and healthy back workshop. Thank you to everybody who is hopping on and joining us for the workshop. I am Brian Broussard, the physical therapist here at Alliance Regenerative Rehab. And
John Broussard, osteopathic physician and regenerative medicine specialist at Alliance.
it is
I'm Christina. I'm a student intern.
awesome. She's also a physical therapy intern. She's in PT school. But yeah, so let's go ahead and get started, guys. Thank you so much for devoting your time on our Tuesday night. I know you guys are busy, but we think we're gonna give you guys some good information to help you out if you're struggling with back pain or not. So let's go ahead and get rocking and rolling. All right. So this workshop is perfect for you if so you're currently struggling with back discomfort in the gym, on the golf course, during your run, during your marathon training, your 5K training, throughout the day at work or at home, playing with your kids, or you maybe tried some things to help back your own back pain, right? Maybe you've been dealing with back pain for a while and you've tried some traditional methods of relieving your pain. Maybe it hasn't helped much, got a little relief, but not all the way. Maybe it plateaued. We heard that today. Or it kind of keep coming back and you're just looking for other things, right, to help you out. Or you don't have a clear answer on why you have back pain. So maybe you went to somebody, but you didn't really like the answer that they gave you, and you're still a little confused. And then also you want solutions besides surgery, cortisone injections, medications, or extended time off from what you love to do, whether that's in the CrossFit gym, whether that is in your apartment gym, running, anything like that that you love to do. You don't want to spend time away from it. And then also for the people who don't have pain at all, and you're just looking to find a way to be resilient and stay away from back pain because you don't want it. So yeah, that's for you. So anybody who's watching this right now, you're gonna get some benefit from it. All right, so by the end of this workshop, you will learn 5+ simple stretches and movements to help you with your back pain, and to also get some relief, but also make you more resilient in the future and through your movements that you really want to do. Okay, so and then why common treatments don't fix your problem. So those cortisone injections, those surgery, maybe some other things that you tried in the past and didn't really give you relief. We're going to talk about those things and what you can do about it. And then why not all back pain is the same. So there's no, one back pain is created equal. They're all different and everybody is different. So those are just 3 things that you're going to learn today. Anything else you want to know? Okay, cool. All right. So what's in it for you? So by the way, this picture was taken. I got engaged like 4 weeks ago. And this was at the engagement. So we're hanging out. And we're trying to figure out what I just did. Just kidding. Super happy. I already got the marriage. The date already picked out and everything. So yeah. So what's in it for you? So why are you here? Why are you going to stay the whole time and watch all this stuff? Because it's going to get you to stay pain-free or reduce any, current back pain that you may have that is making you inactive, and kind of affecting your active life that you want. And then, like I said, maybe it's not so active anymore. So to do this, and this is why we do what we do, is to get people to stay active and to keep doing what they love to do. And it's going to allow you to feel more confident in your back and your body's ability to handle whatever you want to throw at it. Whether that is deadlift, whether that's a marathon, whether that's throwing your kid up in the pool, et cetera, et cetera. And then get back on a consistent workout routine and join your friends without holding back, right? A lot of you like social circles. You have your friends that you enjoy doing those things with, and we want to keep you doing that. And then also to attain the fitness level that you desire. Some of you have goals of being fit. Maybe you want to get a certain look or body fat percentage or just a health perspective. And maybe, it's hard to do that stuff when you're in pain. So, and then to be more productive at work and at home. So to be realistic, back pain doesn't just affect your activities. It can affect your work life and your productivity and, how much you bring it in. So all that type of stuff is affected by how you feel. And we want to help you with that.
And your mood.
And your mood.
And your circles.
And your circles.
With you.
That's right. So let's keep on going.
So maybe refer your husband or wife to this webinar.
For real, Hey, honey, you slacking a little bit on the monthly income. Let's get it going. So yeah, just some important notes. So this is not medical advice. It kind of is, but it's not medical advice specific to you. Okay, so this is not treatment. Um, this is like valuable information, but it's generalized from things that we've both seen over hundreds of patients that we've seen, and we're kind of just picking out things that we think is going to help you out. So it's not a complete solution for anyone who's dealing with back pain or any type of injury. But it's every person needs an effective plan, and it needs to be customized and individualized to you and provided by a licensed healthcare professional or provider that's qualified to evaluate and treat musculoskeletal issues.
Who would that be?
I don't know. Maybe us, a physical therapist.
We could do that.
We could do that. Yeah, we could do that. We like doing that stuff. Can we do that?
We can do that.
Yeah. But yeah, so, and that's what we like to do here is very, very customized and individualized because everybody's different. So, but yeah, actually, I think it'd be a good time to, before we talk about who we are, John could tell you about one of the patients that we saw just recently, who's a great example of who somebody was dealing with back pain.
Yeah, so we had a patient move down, I guess you'd call it snowbird or whatnot. He was transferring his business down here from Michigan. And he had an experience with prolotherapy and working with some people up north and sought us out for that and physical therapy. We identified a lot of issues in his back with the ultrasound. And so a lot of these issues were not previously identified before. Even though he got improvement, they were kind of plateaued. We started working with him between our co-evaluation that we do here, where we have both eyes of physical therapy and physician. We picked up a lot of extra things on this guy. So we started getting to work, doing a lot of prolotherapy that to a level that he's never had before. And we'll get into what prolotherapy is. And then that combined with his strength and physical therapy and training for the activity level that he wanted to attain really set this guy up for a lot of success, a lot healthier and fun lifestyle while he's down here. His main thing was wanting to be on the water a lot. So he got a couple of new jet skis and he's like, just keep me on the jet skis on the weekends. So we did. And he was pounding the jet skis, pounding the waves. And he was ecstatic that his back held up. That's why we do what we do. We do things differently for that same reason. And Brian can tell you a little bit about what we know what you were doing on this side for him as well. I mean,
yeah,
there wasn't a whole lot of downtime between our treatments, and you can.
Yeah, I mean, he's doing good. I mean, started out with a lot of breathing work, and then really focused on that stabilization of the lumbar spine and the pelvis, stuff that he kind of didn't have, because whenever you have back pain like that, those things kind of, or chronic back pain, those things really start to take a hit and they don't work as well. So, combined with the prolotherapy and everything that we did, John did, man, he was doing really, really well. Started to do deadlifts in here. But yeah.
Yeah, we actually found some issues in his core, the front part of his core, that were creating weakness in his back that wasn't helping the situation. We also found some things in his hip. So we tied all those pieces together and we treated him as a whole, we didn't just treat his back pain, we treated everything that supported the back too, which is why I think he did so well.
Yeah.
Plus he had some cool docs working with him.
Yeah, absolutely. Here we're kind of cool, I guess. I like that fun in here. But yeah, so we, I mean, that's just one patient out of a lot of them that we've been able to treat. A lot of moms, a lot of had some money in today, some hip pain, but she also she has kids, and there's definitely something going on in the lumbar spine in the back that we always consider. So all those people, we can help a lot of people. That's what we love doing. So, but yeah. Anyways, who are we, bro?
So we are the dynamic duo of Alliance. So we created this unique sports medicine clinic. We wanted to keep it small. We don't want it huge. We want to provide an option and solution to patients who can't find it anywhere. I don't know how many times, it's starting to become daily now, that people have been dealing with pain, back pain, done a couple of things, and they just gave up. They just thought that's the way it is, and they live with it. So we said we're not okay with that, and we fought hard and found this space downtown in St. Pete, very accessible to people, and we created what we needed to provide you all with treatment options, diagnostics and treatment options.
Mm-hmm.
So we'll show you got a couple of pictures here. On the top left is our space during renovation where we started. We had a couple
COVID.
In the middle of COVID. Well, that'll be another webinar on its own. So we had a couple of things that we wanted that were like non-negotiables. We wanted lots of windows and natural light and a healing space. We wanted some water and greenery out the windows. And we wanted parking for our patients and a space to go outside and do activities, running, etc. And we found all that here. So you can see out behind us, we've got the pier, the bay, and the park. So, and we have attached parking. So we have everything we want.
Mm-hmm.
Brian takes patients out into the park, on the pier to run. If it's raining, go in the garage, do ramps, whatever. What's going on down the bottom left?
Oh yeah, so this is actually the Sunshine Soul Sisters. It's a running group, kind of based in St. Pete, Seminole, and this is in the winter, this past winter, where we're doing a glute strength workshop for runners. So we went out and met them at Seminole Lake Park, and we did a pretty fun glute workshop, talking to them about glute strength and importance of as a runner. That affects a lot of things as a runner, not just the hips, not just the legs, but also the back as well. We had a pretty good turnout. We had a lot of fun. It was an awesome day. But yeah, we love being out of the community and helping and just kind of sharing knowledge and giving as much as we possibly can to help people out.
Yeah. On the right, we have a couple of pictures just from some more outreach stuff that we love to do. That's probably our favorite thing we do. It's a lot of fun engaging with people, meeting new people.
Mm-hmm.
Top one's a golf tournament where we're just working out with golfers, stretching them, warming them up before they play or after they play if they have issues. Bottom right is actually from Monday at a CrossFit box in town where we went for the Murph Challenge, which was a blast. Coaches, athletes come over wanting answers to their pain because they want to keep doing what they love to do.
Yeah.
In the middle, community.
Yeah.
Community and family. We love to have fun, and we use our space to engage with our community and our family and group workouts.
Mm-hmm. Yeah. So I'm, like I said, I got engaged, and my fiance makes me carry her sometimes. So it's
so you'll be using these back workouts?
Yeah. And then the guy on the left is Justin. He's a client and a friend, but you'll be seeing him in a little bit at the end of the webinar. And then that's Danielle. She's a registered dietitian. And
my girlfriend.
But yeah, so we like to sweat a little bit in here ourselves. So, all right. So, like we mentioned before, not all back pain is created equal, and there's a ton of different pictures and ways to show you this stuff. But this is just one little simple one. We see this picture is basically showing those little X's on the left here, or basically showing this is like a symbol for a trigger point, right? So there's some tightness in the muscle. The muscle is like held up in like a long-term contraction, and it's becoming painful. And what's happening is these little red marks on the glute and like down the middle of the sacrum area right here. And then also on the front is where the person may feel the pain. So, even though the person feels the pain on the outside of the glute, even a little bit lower by the gluteal fold, we call it, the pain may be coming from a muscle that's deep in the back called your QL, your quadratus lumborum. So, one way we could treat that is with dry needling or soft tissue, and that can help reduce some inflammation. But it all goes to say that, even a glute med issue and the side of the hip can also cause pain right here in the side of the hip. There could be radiculopathy coming from the back that could be causing pain. But you may feel it not in your back, but you might be feeling it in your butt and into your hamstring.
Yeah, and vice versa. Your back pain, pretty much where those X's are, could actually be coming from your glute. You could have a reverse scenario where you have trigger points in your glute that you perceive to be in your back.
Mm-hmm.
Sure, you can get massage. That's great, but when these things keep coming back, we got to find the root cause of the problem and fix that, so that this stuff just melts away.
Yeah. Yeah, that's why we, when a patient comes in here, we do a pretty comprehensive examination, and we get to know them first, because every patient that comes in here is a person, and we don't want to just treat people like some places do and not even know who they are. We like to talk to people, like to understand how many kids they have, what job they do, family, where they're from, et cetera, et cetera. Get to know what they love to do, and we take that into consideration, and we evaluate them, and get to know, where their pain is, what could be causing their pain, their history, and all that stuff lets us know, along with our functional exam, and then some imaging, what can be going on and what the actual reason for the pain is. So everybody's different, and we like to get down to the why. Anything else? All right. So this is another example. All right. So, low back pain is a big thing. Like the number one cause of pain in like America, probably because we all eat Chick-fil-A so much. But a lot of people have, especially during the past year, have these upper back and neck symptoms and pain, headaches, and it's because people have been working from home. They've gotten to a bad posture. Maybe their workstation at home hasn't been really what it is. They've been working out in the gym like they used to, and starting to develop these things and pain in the back, their middle back. So this could be a cause of back pain as well. And like to treat everything, together. So the left picture is like it's your rhomboids. So they attach to your spine and to your scapula. They help control your scapula and move your scapula as you raise your arm above your head. They can get really painful if you have like a forward slouching posture, and they get stretched out. And they can also reproduce pain above and below where that muscle is. So, rhomboids can even cause neck pain. And the ones on the right is your trapezius muscle. So your upper trap here, and then your middle trap in the green, and then your lower trap in the pink. All of these muscles work, to help keep you upright, and they get really pissed off if you stretch them out and leave them in a bad position, and they start to over dominate, etc.
Yeah, a new buzzword floating around: tech neck. All of this is involved in tech neck.
Tech neck. Tech neck.
A little bit.
All right. So I'm not really sure what's going on in this picture, but I'm going to try to interpret it the best way I can. So obviously we have a woman carrying a baby. It looks like she has back pain, but I'm not sure what's coming out of this baby. It looks like, you got bad back, you got probably an unhappy baby. I'm inferring that because, they say happy wife, happy life. It looks like happy back, happy baby. So if you want your baby to be happy, you should have a strong back. You can see this posture here. She's just resting right in that low back with no glute activation. Knees are locked, and you can see these traps are stretched out here. This is not going to be a good situation in a few months. Just imagine when this baby's a little older, as a toddler, or wants to play in a jumpy house, this lady's back's going to be killing her. So we want to avoid all this. We want to treat this, even if you don't have pain, we want to keep it that way. And this is a big area that is often overlooked. And this lady probably has some issues here. This is the back of the pelvis. So we're looking at the back of the hips. So this is the left hip, right hip. Here's the spine. And the spine ends, and you have something called the sacrum. You've probably heard of SI joint pain or SI joint instability. The SI joint is right in here. There's a bunch of ligaments that crisscross in different directions and in different layers. And then when these can get laxed, they can get torn, They can become insufficient, so they don't hold their tone and their elasticity like they're supposed to. For various reasons, trauma or bad posture for a chronic amount of time, but also during pregnancy. So these, as women become pregnant, they release a hormone. And that lady in the last picture had the same hormone released, and these ligaments get stretched out. So during that time, they can become very painful, and sometimes they don't go back to where they were supposed to be. And we have very good techniques to helping ladies and guys too with pain back here in this area. And this is just a picture of us or me scanning a back. Patients on the belly, we just use an ultrasound, just like we're looking for babies. We can see into the body, the soft tissue, and this is the monitor up here where we can see some pictures of some ligaments and vertebrae in the back. And we can go do that. So we can go look at some of that.
All right.
Christina is volunteering her back to do a demonstration. That was not her back.
So we're going to take a little ride back down the hallway to the office areas. We're going to go in Dr. John's office.
Is there a way to zoom in? Is it open? We need to.
I can.
The lights too.
Yeah.
Let's say focus on the TV.
Yeah. So, where's the diagnostic ultrasound? What are we about to look at? What is this?
Let me close that door. All right, so with ultrasound, so X-ray looks at bones and spaces. MRI, we can look at bones, bone marrow, can look at tendons, ligaments. This can see bones to a certain degree. You can see soft tissue, but it's a much higher detail and resolution than these other imaging modalities. So we use this to look for pathologies, to guide our treatments. We want to see what's going on in someone before we start treating them. So what we're looking at here is we're looking deeper into Christina's back with my transducer up here, which is my little, like some patients call it magic wand. They think I can see everything. So we see the bone here. This is the spinous process. This is what you feel when you run your finger down the middle of your back. And to the left is her muscle, a muscle group, and to the right is a muscle group. If we look down here, we can see her top of her pelvis. We can see the some of these ligament groups that we were pointing out in the back, these SI ligaments over the SI joint. So we can see these if they're loose, if they're torn, we can pick these out. And then if we need to treat it, we know exactly where we're going. If I go further up, then we can see a little joint. So this is where one vertebrae meets the other. This is where we get our motion through these joints. These joints can get irritated, just like any other joint. You can get arthritis, they can cause pain. So we want to see what's going on in these joints. If we go up a little further, we can see another joint. And if we come out a little bit, we see another part of the vertebrae. And attached to this part of the vertebrae is a lot of tendons that support the core and some ligaments as well. We can actually see a ligament here. This ligament helps to stabilize the spine and the pelvis. So we're looking at all these things when we evaluate back pain. We can also see in between the spine.
How'd you get to know how to read all this stuff?
Well, I took a weekend course. No, this is lots of training, lots of years, lots and lots of hours and lots of experience and lots of questions. Seeing things on here and not knowing what it is, and then having to either look it up or find help. I learned the most through my patients. Every patient is different, and we should apply it to others. So these are those bones that we saw here. These are some of the ligaments on top. We have the ligaments in between. Spinal cord is way down here. Can't really see it too well. Um, but that's pretty much the gist of what we're looking at in the back. If we need to see anything else that we can't see here, we will get an MRI. Now, this area here is the back of Christina's pelvis. This little thin piece of tissue here running up the back on top of the muscle is actually part of that tissue where Brian was pointing out the trapezius. So this piece of fascia is layered with multiple layers of tissue in the back. Actually, the top part of the layer is connected to your arm or to her arm, which is hard to imagine that your arm connects to your low back. So low back pain can contribute to arm pain, shoulder pain, neck pain, because as you can see, we're all connected. And if we had time, we could follow this all the way up to her back and you would see where that connects. That's pretty good overview of that we can see into your body to help better diagnose what is going on. Thank you. So, you know, a lot of times patients will come in, they don't have any imaging, they don't have x-rays, they don't have MRIs, and most of the time they don't need it. Typically with our physical exam that we do, as well as this ultrasound, we can get all the information that we need to adequately and thoroughly treat someone. If we need information, you know, if someone obviously has some radiculopathy really bad or a foot drop, something that's concerning us for something deep in the spine, then we'll get further imaging. But for the most part, evidence supports MRIs largely unneeded, surgeries, cortisone injections largely unneeded. This is the wave of the future for backs and sports medicine. So you're gonna start to see more of this stuff, and we're doing it here. So we'll teach you some more about it later.
Yeah. All right. Let's head back in the gym.
Thank you, Christina.
Another cool thing about the ultrasound is that you get to get the results immediately. You know, so you get to come in, get scanned, get all the answers, and leave like with a plan and understand what's going on and how we can fix it. So you don't have to wait. You know, you don't have to go in for your doctor's appointment and get sent for an x-ray or to get sent for an MRI and then have to come back a few days later and then get the results and then figure out what happens then. We've heard people, we actually have a client now who's been with us for over a year and a half, who was frustrated because it took them like a month to figure out what was going on. They still didn't even get, the month ended up coming to me, and yeah, it took forever. It was running through the, you know, that little system. So we try to bypass all that.
Oh, one thing I didn't show. So when you get an MRI, they take multiple pictures and they put them all together, or they take slices with this technology and put them all together to try to create an image. And that's what we get in an MRI picture. So these are static, caught in time pictures. The benefit of the ultrasound, another benefit, is we can move tissues with either pressure of a finger, pressure of the transducer, or we have the patient move, and we can see these tissues move in real time. So we can see like how are they affected? Are they loose? Are they torn? Is there fluid coming up from the joint when we move it? So we can look at all those things, like Brian said, real time. The answer is right there.
Yes, yes, yes. All right. Hope you guys enjoyed that. I was a little surprised. You didn't know you were getting that. All right. So some movements. All right. So like we said, we're going to go over a couple things that you can do immediately that's going to help. And Christine's going to be the model.
The demonstrator.
The demonstrator.
She's a great model. Great anatomy, as we saw.
And all right. So Christina, let's go ahead. If you guys can't hear me, I'm going to walk you guys through it as we demonstrate. If you can't hear anything, just go ahead and type it in the chat section, but you should be able to hear everything pretty well. All right, so first one, like we said, not all back pain is created equal. There's a lot of factors that can contribute to your back pain or back stiffness, et cetera, whether you're a golfer, you're a runner, whatever it may be. One of those things is hamstring tightness, and hamstring tightness can be present because the hamstring hasn't been moved through an available range. So maybe it is, actually stiff or restricted to elongate through a lengthened state. But tightness can occur because of weakness too, that often people get confused, especially with the hip flexors and everything like that. So we're going to go over active hamstring stretch. All right. So let's show them. So she's going to lay on her back. All right. So what she's going to do is have both legs straight out. One leg is going to stay on the ground straight. The other leg is going to stay straight as well, but she's going to raise her leg up off the ground. She's going to keep those abs, that core engaged. She's going to feel a stretch on the back of her leg. All right. Now she's going to go back down. She's going to bring it back up. So she's using her quads. She's activating her quads and her hip flexor muscles in the front of her leg to raise her leg up, which is going to kind of tell your hamstrings to relax. All right. Just like if you're making a bicep curl, if your triceps wouldn't let your arm bend, then you wouldn't be able to make a bicep curl. So you have to relax. Same thing if you did this way, the bicep has to relax. All right. So, that's a good warm-up exercise, dynamic stretch you can do before you go out and work out, or just do it in the morning when you get out of bed. But we'll see. People probably just grab their phones and look at their phones. All right. So technique. So that one you can do 10, 12, it varies by how many repetitions each side. All right. The next one are quadruped spine cores. Okay. So I'm going to walk her through it. She actually hasn't been shown this one because it'll be learning for her too. So go on your hands and knees. All right. So a lot of you guys have probably heard of cat camels. Okay. Which is very generalized way. So do a cat camel real quick. All right. You can Google this and you can find it on YouTube. All right. We're going to do something a little different. And this is going to be more specific to the joint. All right. To each segment. So it's almost like an accordion. The spine core is you're going to be controlled articular rotations is what it stands for. But we're going to try to focus specifically on each segment. So what she's going to do is go into like a rounded position, like where you start. All right. So all her spine is nice and flexed all the way through, even her neck. So what she's going to do is she's going to keep this part of her back like this. So she's not going to move it, but she's going to start from her hips, and she's going to try to extend her spine and her hips. So she's going to come just like that, and she's going to walk it up. She's going to start to bring her chest down to the ground. Extend through your thoracic spine, all the way down, push shoulder blades, and up. Now she's going to keep this extended, and she's going to start to flex her spine. So actually extend her hips and flex her spine. It's confusing, I know, but what do we like? So you're going to start to, let's get into the nitty gritty. All right, so then all the way up, curl, 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 and then back down. So she can reverse this as well. So she can start to extend from her neck first, keep this nice and tucked, and then start to sink down. Those kind of like dominoes down. So you get to move how your spine actually moves in real life. All right, so that's spine cores. All right, next one is banded hip flexion. So I've got the yellow band. So like I mentioned before, how the people think the hip flexors are tight and they try to stretch them and stretch them and stretch them, and it doesn't help. Your back pain's still there because your hip flexor, your psoas attaches to your spine. So it's going to pull the spine forward, all right? And it's going to cause some extension in your lower back, and it's going to hurt. So what she's going to do is...
Where does the psoas connect? Why does it do that?
That's just on the front of the hip here, and it goes deep down. That's why whenever, you might have maybe somebody tried to dig into your belly, it dives deep and attaches to the front part of your spine.
So it's a back muscle.
It's a back muscle.
Wow. So it's important.
It's pretty important. Yeah, it's actually a stabilizer in your spine. It's strong enough. But yeah, so she's gonna keep one leg straight, other leg, she's gonna bend and drive her knee toward her same side shoulder. But she's probably gonna feel, if she has poor stabilization of a deep muscle in her core, she's gonna feel like her back is trying to extend. She's doing a pretty good job. All right, you're gonna go back. So she's trying to keep these ribs from doing this. She's trying to pull them down. All right. At the same time as she's bringing her leg up, so you can do all the other side. She's trying to pull that or squeeze that glute or bring her knee up, which is going to rotate her pelvis backwards and create a nice tension into your core and the back. So banded hip flexion. If you feel a pop or like something happen in your hip and there's no pain, don't freak out. It's anatomy. As long as you're not pain, it's usually okay. All right. Those things. All right. So let's go for diagonal tension dead bug. So we're gonna work on some more core. I'm gonna hook you up with that ball is gonna be big.
Side note to that.
So
if you feel popping in the front of your hip without pain, it's probably okay. If you feel popping or clicking in your back when you do this, like a little click, 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 you may have a little instability in some of those little joints that we showed you on the ultrasound. So that's another story. We're not going to cover that today, but you may want to look for someone who can help with strengthening around those segments.
Yeah. All right. So next one, we're going to do diagonal tension dead bug. So you can do this with a yoga ball your size. So she's going to put her hands up towards the ceiling. She's going to compress that ball with her hands into her knees. That's going to like immediately engage all of this. So a lot of times this is not working really well and the back is going to suffer from it. So what she's going to do is she's going to squeeze with her right hand into her left knee, and she's going to straighten this leg out and that arm out as she keeps compression and then bring it back up. So when she does that, she's trying to keep this part of her back from coming off of the ground. She's trying to keep it nice and neutral. Almost think about trying to pull your belly button down to the ground. Your back doesn't have to be completely flat, but your spine isn't made like that. But that's going to help activate that core like we want to. If you have back pain and you try this at home and it's hard for you or it causes pain, then all you got to do is keep the knee bent and just drop the heel to the ground, bring it back up. Just a little regression, okay? That's diagonal tension dead bugs. All right. Got two more for you guys. All right. Next one. She's going to put this band, these glute loops are great. And then she'll put that band around her knees. All right, she can go on her hands and knees. This is a fire hydrant. There's a lot of exercises in PT world that are pretty funny names. So fire hydrant, as you can see, fire hydrant.
So, our mom is on this webinar, I believe, because she's got some back stuff. I'm sure she remembers a picture of me and my dad doing this in Colorado when I was a kid.
Memories.
There was no band involved, though. So hence the term fire hydrant.
So go back and do that again for me real quick. So what she's doing here, great stabilization for the core. And, you know, when you have back pain, a lot of times your back gets tight, your hips get tight, and your hip doesn't independently move like it by itself like it should. So your back starts to move, your hip mobility starts to suffer. This is, you know, whether you're squatting or doing anything, running, you get tightness in your hip, it can affect your back. So, and then vice versa. So what she's trying to do is nice tight core, and she's trying to drive her knee out towards the camera, but also keeping her knee nice and low to the ground. That's what she's thinking about. So that's keeping her spine stable. So her hips are basically flat, right? So I can literally put that right there, and she can kick her leg out, and the foam roll is not going to move. The wrong way to do it is, oh man, like that. All right. So we don't want that. So that's working on your glute, pelvic stability, lumbar stability, and
Pavlov press.
then a Pavlov press. All right. So I'm going to hold this for Christina. She's going to do a Palloff press, one of my favorites. And
You don't need a partner for this.
yeah, you can tie it up to a squat rack, to a post. You can stick a band in your door. A lot of ways you can do this, and there's a lot of ways that we can make this fun. This is just general, basic way to do it. People get crazy in here when I have to do Palloff presses. All right, so we'll show you a couple different angles. So she's setting up, grabbing the band. She's holding it with the hand closest to where the band is tied to. That's her right hand. And she's wrapping her left hand around the other one. Very important detail. It's all about the details. All right, so she's nice athletic posture. Her back is nice and neutral. It's not actually, so tilt that. Yes, there you go. All right, so now she's gonna press that band towards the camera.
We should
And
show
then-
a side view too.
Yeah, I'm gonna do. And then she's gonna pull it back. All right. So that band is trying to pull her towards me, her body towards me as she goes out. All right. And then back in. You can turn this into a oblique rotation, but this is very general, important for especially if someone has back pain to work on anti-rotation, so controlling rotation. So let's go face that way more. So you see the side view. So show, Christina, can you stick your butt out more? All right, we don't want to set up like that. You see that curvature in her back? You can probably eat a bowl of cereal over that right there.
Our gumbo.
Not good. All right. So we want to tilt the hips up, bring the ribs down, right there. And that's a nice neutral spine. And that's where we want to. That's going to cause more back pain if you're doing it like that. So push out like so, and then back in. Trying to breathe while you're doing this. All right. So that's just one variation of the Palloff press, the most basic one you can do. You can do it kneeling, standing, squatting, lunging, all kind of different ways. All right. So hope you guys enjoyed that. Let's rock and roll. All right. So, as you mentioned earlier, we talked about some limitations and or why common treatments may not work or fix your problem. You went to see somebody to get treated for your back pain. You got some treatment, some answers, or you thought was answers, and it didn't end up panning out. And we'll talk about why there's some limitations with some of those things.
So, ice and NSAIDs, if you hurt yourself, you're a stranger back, yeah, throw some ice on it. That's going to control some inflammation. NSAIDs are anti-inflammatories. They also control inflammation, but they also stop healing. We need to go through all the phases of healing. There's 4. NSAIDs are those types of medications, stop it in its track. So you're actually stopping the process of healing, which is dependent on inflammation. It's going to stop all the blood flow from getting to the area and all the nice healing agents that are in the blood. No bueno. When you start to do that, you can also increase risk of further injury to that area, to other areas. It's bad for your heart, it's bad for your kidneys, bad for your gut. So we don't want to do that stuff. On the same level, cortisone injections, they also stop inflammation. They're the most potent anti-inflammatory we have. They are widely overused. Most of the time, it's not inflammation that's the problem. And a lot of times we say, you guys too, probably, maybe you've had a few of these injections and maybe it didn't work. So they decided to give you another one. I don't understand that, but this is what people do because that's what they've been taught. The side effects with these things, they're actually not FDA approved for back pain, but they still do them. They also destruct the tissue over time. They weaken the tissue to degrade it. And it increases risk for arthritis by degrading the cartilage. Also increases your risk for rupture if they get it into a tendon, ligament, and such. So,
yeah.
What about surgery?
It's pretty brutal.
Everybody wants to do surgery because it's like a quick fix. It's like done, final, right?
Yeah. Well, what happens is, back pain is one of those areas where a lot of people suffer from it. And the quickest thing that they can think about is going to their orthopedic surgeon. So it's tough when that person maybe gives you a cortisone injection or someone in that kind of flow of things, give you something and it doesn't work. And then the next step would be to either like stop doing what you're doing, or well, we can just kind of do like a little laminectomy, or like a little like
Oh, let's burn the nerve, and then just
let's
if
burn
you don't
it.
have the nerve, then you stop the pain.
Burn
right?
it. Yeah, burn it. You burn it. Yeah. So like, these things are like getting rid of the tissue that God put inside of you, whether you're religious or not. Hey, they're in there for a reason. We don't like taking things out. So, but all those things can lead to other problems down the road. And we see it all the time. People come in here to see us or explain to us while we're out doing stuff. They had this surgery back in 5, 10 years ago, a year ago, and they're still having the same issues. And they spent all this money. Now they have metal. They make the metal detectors go off. They have to go through the separate thing whenever they go to the airport, and they're still having pain. And it's just frustrating.
So to clarify, we're talking about probably 95% of back pain out there.
Yes.
If you're having problems peeing, pooping on yourself, you're dragging your leg behind you, yes, somebody needs to go in there and take pressure off that nerve. We're talking about the other stuff.
Yeah.
So just to clarify.
Yes, very, very good clarification. Yeah. Like we said, not all back pain is the same.
Right.
There are some instances where surgery is extremely indicated, and we send out people for surgery that we just couldn't do it. So yeah, there's better treatments out there, guys. So what are some alternatives? So a little chart we made up, and just some kind of separating the two, splitting it up for you into a chart. And it's a traditional system of healthcare, and the kind of alternative route and options for treating pain.
Right. So the traditional approach is rest, anti-inflammatories such as your NSAIDs or cortisone, or some muscle relaxers, and that just doesn't do very well. Most of the time, delays healing. A lot of time off of work. Plus, you have the neurological effects from the muscle relaxers, the increased risk of falls and driving, etc. So what we like to do is give you an alternative, and that's regenerative medicine that promotes healing. We mentioned prolotherapy earlier. Prolotherapy is injecting or using some inflammatory substance that promotes healing. I know we'd said that inflammation is not so great, but it is great because we need it for healing. So we promote the healing with that. And that's where you hear about maybe PRP or stem cells or those types of things. It all kind of falls under this same umbrella of regenerative medicine or proliferative medicine. So that's another option to heal your pain and tissues.
Yeah, and then traditional setting, we hear this all the time, which a lot of people, why they end up coming to see us, is because maybe they've been to someone, even PT, like the next one down. But, a lot of times there's high volume places where they don't really, you have to wait, and stuffy waiting rooms. You're waiting a whole lot longer than what your appointment time was originally scheduled at. And you're spending maybe 10 minutes with the doctor, and it's rough. You're waiting for the X-ray, MRI, like I mentioned earlier. And we don't we want to try to give something different. And that's what we've created here, where you can get, like I mentioned earlier, in-office diagnostic ultrasound imaging. Our waiting room is, can probably fit, really, it never fits more than
3 people and a
three
baby.
people and a baby. So people are moving, and it's extended time with us, so you get what you're paying for.
And as far as the imaging, the MRI, Christina doesn't have any back pain. Thank God, she's healthy. She has no back pain. If we were to MRI her back, we would probably find something in there. That's just life. As you have more birthdays, you get more things wrong with you. And the research supports that MRIs for back pain is not indicated because you find things in there. If you go hunting for things, you'll find them, and it's not going to probably be the source of your pain.
Yeah.
So that's why we have the ultrasound to help with that.
And then, talk about physical therapy as a traditional, in terms of the way that the model of physical therapy is all over the place. How you go in, you see your physical therapist for 10 minutes or so, and then you get passed off and you're doing exercises on a big, large bench with a PT tech who's in high school and can't even grow a beard telling you what to do. doing towel curls and like, heat packs, and it's crazy. And people don't like that, and they recognize that. And those are the people who come in here and they tell us about it. And so yeah, we offer a little something different. It's all personalized, one-on-one. Everything is different here. Um, yeah, and then traditional, surgery, like we mentioned earlier, surgery in this term, like when it gets to this level, or just give it up, just stop running. You probably shouldn't do any more marathons. You hear that, and it's really sad, and it kind of makes me want to cry.
Yeah, or they've gone through the physical therapy and the insurance doesn't. They've only approved them for so many. They
Mhm.
won't use any many. So at that point, it's kind of like you got what you got, and you think that's as good as you're going to get. Well, that's only because you've done a very small percentage of diagnostics and treatment. So
Yeah, yeah. And the alternative is our method. It's the Alliance method, which is why, like John mentioned earlier, that's why we started Alliance Regenerative Rehab, to make that marriage, because we know that when you combine these alternative methods, you get extremely um, more beneficial outcomes, and not just short term but long term outcomes.
yes.
And that's what we're all about here. All right. So, do we got any questions for anyone out there? We could take some questions from you guys. You can post it in the chat, or you can unmute yourself and just shout it out.
Can you raise a hand? Is that possible?
You can also raise a hand too. Anybody? Danielle?
Bueller.
Bueller? No
So
question.
I have a question, Brian.
What's up?
Those exercises that you suggested people do, are those going to relieve my back pain, or are they just going to strengthen my back? Like when do I do those exercises?
That's a good question. So those exercises may relieve some of your back pain, actually, depending on what's going on. I think those, like the active hamstring stretch, excuse me, that's going to give you some immediate relief and more flexibility in your hamstrings, which can cause some back stiffness and tightness. So that can give you some immediate relief if you feel looser on the golf course, help you feel looser on a tennis court, whatever. The exercises that are strengthening based, like the Palloff presses, the banded hip flexion, those are activation type of exercises. So whenever you activate that core, it may help improve your posture immediately. It may help you feel more activated whenever you're moving around. That can give relief. But these things are also really more important because they help just to strengthen and uh, help get your body and your back support that it needs for the long term, and you're kind of building that foundation back that maybe you kind of lost. So it's going to help you more in the long term probably than the short term. So it has to be consistency. So one time a week is probably not going to cut it. You have to do these things 3 to 5 times a week is what I tell my patients. Anything more than that is too much. Anything less than that is not going to do much of anything. So, it's kind of like a diet, or, you have to get consistent at it to get results. May I
Okay.
answer your question?
Yes. And then if I don't have back pain, these would be good to do, like you're saying, because it's strengthening, so it's also preventative, right?
Yeah, correct. Yeah.
Okay.
So these things, actually everything that I showed you guys are great for like before a activity. So whether you're in the gym, you're kind of getting things loosened up. Whether you got for a run, you can do these things to help prepare your body to do activity to put out. So
Okay, that makes sense.
Another great time to do these is maybe take a morning break halfway through your workday if you're at a desk all day. Everybody's working from home, sitting on a couch. If I go to y'all's house and look at y'all's workstation, I'm going to scold y'all. They're not good. So take a morning break, run through these exercises, take 5 minutes, get some water, get back to work. Do the same thing in the afternoon. So that'll help loosen up your back, move your back around, activate your core. Those cars are awesome to get things moving. Everything just gets tight and stiff and starts getting compressed. I love doing those cars. So that's awesome to do those for anyone, either at work, sitting at a desk, at home, sitting at a desk or couch. Those are good.
Anything else? Okay. Sweet. Thank you. Any other questions?
Those are great questions.
Yes, yes, yes. All righty. Cool.
Oh, we got another one.
We got another one?
You got unmute yourself.
Okay, can you hear me?
We can hear you.
Okay, I have a question. This is Mama. I continually have trouble with my glutes, and I know you've treated me, and I do have a stationary job. I sit at my desk quite a bit. So why does my glutes continually to act up and then the pain goes down my legs? Is that coming from my back? Or is there any of those exercises that you showed could help me with my glutes, the pain in my glutes and my hips?
So I can take this one.
Sorry.
Are you gonna make us
So, all right, well,
drill sergeant you or
this is Pandora's box. This kind of question here. This is like the end of your shift in the ER at 4 o'clock in the morning, and a teenage girl comes in with belly pain and missed her period. Like, that's a 3-hour workup. I can answer this question because I know this case. I know what's going on with your glutes. The tendon that attaches, so your glute tendons on your hips have something called tendinosis and some like partial tears. And that is what is referring pain down the posterior lateral part of your thigh. So that, in your case, that is what's causing your leg pain, which brings up another point. A lot of people, anytime somebody has pain in the back of their leg, it's always what?
Sciatica.
Sciatica. It's not. So
No.
People get confused and they'll all have sciatica.
My sciatica is messing up.
Well, tell me what that means. Take your finger and draw a line. So that's what's going on in your case. It's the tendon that's referring pain.
Okay, so it's not necessarily me sitting all the time behind a computer, but
Well,
that
I didn't
could
say
be.
that. I just said what was causing your pain.
Oh, okay, but that can make it worse.
It's a contributing factor.
It's contributing.
Okay.
Getting up and squeezing those glutes, working those glutes, working that core, walking, taking breaks from sitting down is going to help.
Okay, I got it.
All right, get on it. All right, thank you. Cool. All right, last offer for a question, and we're gonna move on and wrap this things up. So, all right. So where do we go from here, guys? So like we mentioned before, we do a comprehensive evaluation. We do co-evaluations and individual evaluations. So we want to make a special offer for you guys because you took your your Tuesday night and joined us. So or if you're hopping on this afterwards and you see this, text us as well. But we're gonna offer for you to help you get back to doing what you love is our comprehensive back assessment. So what that is we talk about, like we said, your history. We do like a full medical review. If you have imaging, we like to look at it. Even if you had an ankle sprain 10 years ago, we like take that into account. That's a part of what's happening potentially. Who knows? We do a functional movement analysis, a joint and muscle assessment. So we're looking at your squats, how you move. That's specific to your sport and activity. We had a gardener come in today, and we wanted to see her get down and like she was practicing gardening or doing gardening. So and then taking a look at those joints, your muscle, your hips, above and below, all the way down. And then at the end, we do a personalized action plan where we make a plan with you and work together, whether it's John and I or John and you or me and you. We work together to find something that works for you. And then before you leave, you'll get some treatment to kind of get the ball rolling in the right direction and to make you feel good. So that's $80.
Wait, you said 80?
Yeah.
I thought that's too low.
Oh, really? Is that what we?
Are we really doing it for 80?
I guess.
Oh my God. Wow. So this is crazy. I guess we're doing it for 80.
Well,
Neither one of us actually offer anything for $80. And you're getting both of us for $80. So,
yeah, pretty crazy.
and what's this thing at the bottom?
Yeah. So, man,
You're giving that away too?
There's a bonus.
Come on.
So you saw diagnostic ultrasound done on the computer through Zoom, through the cloud or whatever, how that works. But it's crazy what you can see on diagnostic ultrasound, and it gives so many answers. And we're going to offer that included at no extra charge if you text us or email us 24 hours after you watch this this webinar.
Everyone's busy.
Yeah, so take advantage of that, guys. Yeah, so it's going to be available 24 hours for the bonus. So reach out to us, and then I have the text and the email in a slide coming up here that you can use. All right, just a couple testimonials from people who have been here, have gone through and worked with us, and have gotten results. So this is a distance runner. Well, I think you worked with her, right?
Yeah. So this is a lady we met out at a run who was having back pain after her run. So we worked on her a little bit, and she was kind enough to write a review for us. So we'll share it with you. She said, I discovered them at the end of a 5K race a couple of weeks ago. I have chronic lower back pain after this race with less than 10 minutes of demonstrations on me. So we did some manual work on her. She said, I felt better. However, the best was still to come. I immediately helped my mom unpack boxes sitting on a tile floor all day. I knew my back should have hurt, but it didn't. I thought I would have to stop way earlier than it did, but I didn't. I was so grateful I found them and can't wait for a full session. So that's the kind of results we got with this lady in 10 minutes, which made us very happy. But there's so much more to dig into and to get her long-term benefits.
Didn't she come in recently?
She did. We saw her a couple of other times, and we actually started affecting other parts in her life that she didn't fully disclose. And she just mentioned that as a side benefit that she was wondering if they were connected, and they were. So we helped with digestive stuff, sleep, mood, like all this stuff. She started getting benefits from, which we weren't even trying, but that just goes to show you when you have something going on in your body, like back or spine, other things that get affected.
Yeah, that's awesome. And another one is Justin. So he was in a picture of us working out. He's a professional golfer. Whenever he first started, it's actually with me before we opened this place, which is crazy. But it's been over a year since he's been with us. And so he's referred to me whenever he injured his back at Eckerd and in the gym. And, like you said, when I first came in, I could hardly walk and was in serious pain. Brian did a full assessment, explained my problem, and laid out a game plan to fix it. We started with a lot of soft tissue work and stretching to loosen up the muscles. Once the pain started to go away, we focused on exercises to strengthen the back and surrounding muscle groups. 3 to 4 weeks after starting with Brian, I was playing golf again and competing without pain. My experience with Brian was far exceeded my expectations and was absolutely worth the investment. And Brian is extremely thorough with his approach to rehab and training, and is great at personalizing programs specific to your needs. So, basically, we take everybody different, whether it's a runner or a golfer, we personalize it. And Justin's, not competing, working his way through to get on tour, and he's doing great. And he actually came in today.
Yeah, for a different issue that he had. So we love our patients, and we think they value what we do for them. Yeah.
And I think it's cool because even though he started with myself, that was before even John was around at the time, and he saw the value, and now he has basically, we're his full medical team whenever he has an issue, so we can keep him performing at his best. And whether it's diagnostic ultrasound, Prolo or anything like that, he's got it covered.
So like primary care for your body,
primary care
for your musculoskeletal system.
Yep.
So primary care sports medicine is a thing.
Yes.
And that's us. That's what we're board certified in.
Absolutely. So next steps, guys. So put these things into practice. those exercises, you do them. So many people get stuff, they get advice, and then they don't do it. So guilty. Yeah, same. But if you're serious about it, if you're watching this, then that means you're serious about getting some help. That's a good place to start, like tonight. And then, if you want the comprehensive back health assessment from us, just text us 727-334-7443, or just email us info@thealliancerx.com. Remember, 24 hours from this 6:30 Eastern time, or whenever you watch this, you'll get that bonus diagnostic ultrasound included. But yeah, guys. Oh, hello. Oh, is that James? But yeah, guys. So just like the running client said, the best is yet to come. You just gotta put in the work and be consistent. But yeah, I think that is it. All right, guys. Well, yeah, if there's no other questions, we're going to wrap this up. And we thank you for joining us and spending some time with us. And we hope you got some actionable steps and some information that can help you out with your back pain and get you back to doing what you love to do.
Yep. Thanks, guys. Have a great night.
Thanks, guys. Peace out.